We are lucky to have Matt Kelley with us, health officer for Gallatin County Health Department. Matt, welcome. You've been on the run, keeping up with a rapidly changing pandemic. How are you holding up?
We're doing well. It's day by day. You know, it's been a difficult 2-3 months for everybody, but we have a great team. You know, when we had a lot of cases and active cases earlier this spring. That was a cause of great concern, but I think what I kept harping on and what I kept trying to reinforce is that a lot of the strength that comes from having a diverse, economically strong county. There's a lot. While it brings people in, and we might have more cases because of it. There's a lot of strength in it too. So we're doing great.
Oh, that's good to hear. You guys are doing a fantastic job. You know, among many other things, you all have been working, long hours with West Yellowstone National Park, the governor's office, the state health department, about the importance of if and when Yellowstone National Park will reopen. Can you update us on some of those conversations?
Well, there's active ongoing conversations between Cam Shawley, the superintendent of Yellowstone. He's working with the governor's office in Montana, the governor's office in Wyoming. And he's been really great. We're reaching out to the health officers of the 4 counties that are contiguous to Yellowstone. So Park County, Montana, Gallatin County, Montana, Park County, Wyoming, and Teton County, Wyoming. And as you can imagine, that's really complex. He's got 2 states, 4 counties. They're really trying to figure out a way to reopen it safely. I think we're moving toward that. I think each county has its own concerns. Certainly, we've had more cases. West Yellowstone is a unique situation because it's such a small community, and the potential for overwhelming the healthcare resources there are pretty great. So we're working really 2 tracks there. One, with the park to put in place some things that will allow us to reopen safely. But then we're also working with the town of West Yellowstone and Bozeman Health, community health partners and others to increase the capacity of the healthcare services in West, the testing services in West, so we can do it safely as well. There's no date certain. There's been a lot of things thrown around. I don't have anything. I can't break any news there. But I can tell you that everyone's kind of working together to find a way that we can reopen. There's public health risk involved in that, but as I've said, there's risk involved in not opening as well. So we're trying to balance those things.
Well, that's a huge undertaking, and we can certainly appreciate the effort you guys are making there. You mentioned you were talking about West Yellowstone. There have been now 3 new cases in West Yellowstone in the last week. Does this throw off or delay any second phase of the governor's plan?
Not those cases in particular. I mean, having 2 or 3 cases, we know we're going to get cases on an ongoing basis probably for the rest of the year. What we'd be most concerned about is if we were seeing a regular increase of cases, we were seeing cases day after day, and we were seeing evidence of something that we call community transmission, where we're seeing evidence that the disease is being passed from one person to the next in a really substantial way. I don't think we're seeing that right now. We do have 3 cases, but we're working really closely with folks in West Yellowstone and the family that's been impacted. So it's not going to upset the apple cart just because we have 2 or 3 cases.
Yeah, gotcha. Another thing you guys have been working on, the health board this coming Wednesday has a meeting to discuss Governor Bullock's phase 1 reopening plan as it relates to certain entities, among them gyms, museums, theaters. What can you share with us about the potential reopening of these entities?
Well, Governor Bullock last week went to what they're calling kind of phase 1.5. So it really would allow those types of facilities you've talked about, gyms, theaters, those kinds of places to some kinds of theaters to reopen in a limited way. What we have in Gallatin County also is a local Board of Health rule. The Gallatin City County Board of Health, when the governor came through with his directives on reopening, really decided that they were going to support that reopening, and they created a local emergency rule. The board is going to meet early on Wednesday morning, and they're going to consider whether to alter that rule to, again, be consistent with where the governor is. The boards, local boards of health, have significant local authority to make those decisions. They can be more stringent, they can't be less stringent. So they could decide to become more stringent and slow down. But so far, the board has decided to go along with where the governor is. And I think that they'll probably pay real close attention. I'm not gonna say what the board will and won't do, but in the past, leading into this, they've really, we've really followed the governor's lead and tried to make that reopening guidance work.
Mm-hmm. And that is a May 15th. Is that the governor's directive at this point for those?
Yeah, I think Friday.
Yeah, Friday. Gotcha.
So we're trying to get that done. We're trying to get that done in advance of Friday. That's why we're having a meeting on Wednesday morning.
Gotcha. Last one I got for you right now, you know, just, so say my family is visiting in early August, what should I tell them? Should they cancel or should they come?
You want me to go to August, huh?
Yeah, let's go to August.
I think I would continue to watch what's happening with the number of cases we have, with the level of disease transmission we have in the community. Continue to watch the guidance that's in the directives. And no matter what, as we move through this, we're not going to get to a point in time this summer where we're going to say we're done. We can stop worrying about this virus. People are still going to have to take precautions, still going to have to be careful, especially if you're somebody with an underlying health condition. If you're somebody who has pulmonary problems or diabetes or high blood pressure, those are things that put you more at risk if you are exposed to the virus. Our hope is that as we move through the summer, we can keep the number of cases to a manageable level as we've been able to do so far with the reopening. And that as we move through the summer, we can really enter the fall in good shape. That's my main goal, is that when we get into the fall and the winter, we're not already digging ourselves out and trying to play catch up with a bunch of new cases, because we know in the fall and the winter, we're likely to get influenza come back. And we're also, there's some expectation that we're going to see some degree of resurgence of COVID-19. And so those two things coming together create really significant challenges. And we want to make sure that we're managing our summer so that we go into the fall and the winter in pretty good shape. So people who are considering a visit, I would say in August, I would say continue to watch what's happening here and our success in Montana and in Gallatin County, sort of continuing the trend that we have right now.
Yeah, for sure. And that was something I was going to ask you. You know, there's certainly been talk of a potential resurgence of COVID-19 toward, you know, the fall, early winter. Any insight as to probability of that? Just curious what your thoughts are.
No, this is a new virus. I think, Dr. Fauci has said there's no doubt we're going to see cases, and we're going to see a rise in cases as the weather. We don't know whether that'll be a slow rise or a spike. We don't know if that'll be localized or national. We don't know if it'll be worldwide, for that matter. There's so much we don't know about this virus. There's so much we don't know about spread. I'd remind everybody that this virus we've only known it as a human, within the human body for about 5 months now. So there's just a lot we don't know about immunity. We're just going to have to kind of walk through it together and see what happens.
Yeah, absolutely. Well, look, Matt, thank you so much. I know you guys have a lot going on. You're in meetings constantly. You've probably had enough Zoom meetings to last you a lifetime, but just curious if there's anything else, you'd like to add, anything additional that you guys are working on, you'd like to share with our viewers.
I think just generally Montana has had some success because we acted early and because we acted in a unified way in reducing the number of cases and we think reducing the amount of disease in the community. I think it's important, though, as we move forward, to continue to look at what's happening to our neighbors, what's happening in the Dakotas, what's happening in Iowa, what's happening in Utah, what's happening as far away as New York and New Orleans, to kind of keep in mind that the virus is still out there. It's the same virus. It's a dangerous virus. And that while we've had some success, that's really because we've all been careful. And so I would urge people to continue to be careful, that even as the regulations change, we can get together in groups of 10. I would urge people to really manage how many groups they're in. If you have 10 groups of 10, that's still 100 people. And you're still at risk from everybody that you're in contact with, and you're putting everybody you're in contact with at risk. So really manage those things. It's difficult. I'm looking forward to a year from now when we really know a lot more about this virus, potentially to have a vaccine. But our focus now is on continuing this trend of the summer and moving into the fall and winter in a way that we can continue the success.